So, I dare you to talk about gynecological health in your family. Yes, I dare you. I dare you to talk about gynecological health in your family. Yes, I do have some motives. So, of course, I am a person who has a family. As a matter of fact, I was birthed through the miracle of gynecological health. I came into this being through the miracle of gynecological health. I was born in Louisville, Kentucky, in a hospital by doctors, nurses, healthcare professionals who were aiding my two parents to usher me into the world. And so, even though I do not have a vagina nor a uterus, nope, I do care about gynecological health. I also have women in my family. I mean, obviously the women who birthed me, but also my peers, my sisters, my brother, my sisters, my cousins, the women, my aunts, and my family. It occurs to me that many of the things that happen in our lives seem very personal, particularly when it comes to gynecological health, particularly when it comes to anything to do with our private parts, but particularly women's health. There's so much that's done to medicalize women's health, not least of which is to medicalize childbirth, to look at it as an illness. Even if you look at how you pay for childbirth, it's literally like, okay, this woman is sick. What's the sickness? She has life growing in her. Growing in her. She has life growing in her, therefore she's sick, and we're going to treat her as if she's sick, and when she gets out, then we will discharge her as healthy. And so this sick model versus a pro-health model of healthcare is a big signal to how we think about gynecological health. There are a range of illnesses from that women may suffer from, but even just knowing pro-healthy behaviors, these are things that may not be transferred intergenerationally unless we have those discussions. I have young mothers, more mothers my age, grandmothers in my family, and all of the lessons that we learn together are not often shared enough. We know that I'm Black, so my family's Black, and I come from a poor and working class background. So demographically, the women that I'm related to are of the demographic who have the least access to pro-healthy gynecological choices, choices that encourage them, for example, to breastfeed over any other option. We're in a crisis now of child's milk. I remember a few years ago, I was speaking with a relative, a young mother, working class mother in my family who had just given birth to, I think it was a holiday, but let's just say, I'm not even gonna specify who it is, it's nobody's business. But it was a young mother in my family, and I was home, and there was this infant, and they were talking about Similac. And there are all these jokes that Black comics have about Similac, but as I assessed the situation and saw the pattern throughout my family, the medical care profession discouraged these young women from breastfeeding. It isn't that they explicitly said, don't breastfeed, of course. They presented them with options, but then presented them with options in such a way that said that their own ability, their own body's ability to nourish their child was inferior. Just their diets, everything they ate, how they lived was inferior. Medicalized, right? And virtually criminalized, because many of the things that they would do that would lead to neglect, even of their own health care, because of their own ignorance about, for example, prenatal health. Who just pops out of the womb knowing about prenatal health? Well, these things can really be demonized in the medical sphere and even criminalized. So I'm not even talking about drug abuse or anything like that, explicit criminal behavior, but simply things that we've medicalized to the extent of we've restricted the knowledge of what even prenatal health means as a broader part of gynecological health. I see this in my own family with this. It pains me that people don't trust their own bodies enough to nourish or even have the will to, because I see that there's even a lack of will to breastfeed. And we know, as we all know, let's say it, breast is best. And so there are a lot of ways that I think that sparking off dialogue within our families is important about gynecological health. I haven't said one more thing that might seem obvious here. A, I don't have COVID. I've tested. I do have because the weather keeps going up and down. But the other thing about speaking about gynecological health and me not having a vagina or uterus is that I'm a male. I was born in the gender that I am. And so many people would say, what stakes do you have in this game? I thought I said that in the beginning. I was born. Wasn't even Jesus born to a uterus? None but, what did she say in A9 Woman, Sojourner Truth? Yeah, she said it. She really, really said it. So if it took God and Mary to make Jesus, there wasn't even a man involved. And yet, men, we have stakes in the game. If you don't believe we have stakes in the game and you don't believe that we've literally criminalized the female body, like we're doing now with abortion laws, just check out the links between the word hysterectomy and the word hysteria. We've done some atrocious things to women. It's just ridiculous.